Assalamu alaikum. Shubho Dupur, good afternoon. I'm Khosruzzaman, Inclusion and Community Engagement Manager of Barts Health NHS Trust, also the community lead for London Bangladeshi Health Partnership. On behalf of LBHP, I'd like to welcome you all. Shagotomo asker ei onusthane. We are aware that Bangladesh is currently observing the mourning month. We also pay our deepest homage for the Bangladeshi father of nation, the greatest Bengali of all time, Bangabandhu Sheikh Mujibur Rahman, and those who were killed on 15th August 1975. We will touch on our history as well as the Bangladesh's history in the UK and the contribution we are making to the British society as well as to the NHS. We really also want to highlight the historic health inequalities facing by our communities, particularly in London. We have some distinguished speakers, expert speakers in this event. Particularly, we are honored by the presence of Her Excellency, the High Commissioner of Bangladesh to the UK, Saida Muna Tasnim. We are also delighted to say that Dr. Nikki Khanani, MB, the Director of Clinical Integration on NHS England, will be speaking to this program. Please be aware that this program will be recorded. We request all participants to mute their link. If you don't want to be filmed, you can choose to turn your camera off. Also, we don't have any chat button. However, we have the Q&A button. You can click there and only raise any health-related, NHS service-related questions there. This will be answered in the end of the session by the distinguished panel. Now, let me call upon the co-chair of the group who has kindly introduced our community and this group to the NHS England, is our Riyadul Karim, the Assistant Director of Primary Care, North Central London, ICB. Riyad also co-chair of Enfield Borough Partnership MDT group on immunizations, vaccination and screening, which focuses on narrowing the gap of inequalities and engaging underserved communities through the building trusted relationship with the trusted faith and community leaders in trusted places. Riyadh is also a core 20+ ambassador of National Health Inequalities Improvement Program in NHS England. Before I hand over to Riyadh, let me say it in Bangla. আজকের প্রোগ্রামে আপনাদের সবাইকে স্বাগতম। আজকে মেইনলি আমরা বাংলাদেশের হিস্ট্রি এবং এখানে বাংলাদেশের যে সমস্যাগুলো হচ্ছে হেলথ সার্ভিসে সেগুলো নিয়ে আমরা আলোকপাত করব। আপনারা সবাই আমাদের সাথে থাকবেন। আপনাদেরকে অসংখ্য ধন্যবাদ। রিয়াদুল করিম, Shawan, floor is for you now.
Assalamu alaikum. Thank you very much for that warm introduction, and Zaman Bhai, thank you very much for that. Good afternoon, everybody. This is London Calling, and today we'd like to bring you into this wonderful webinar. Thank you so much to spend the afternoon with us. We've got an array of speakers, health system leaders, national leaders. As Zaman Bhai said, we've got Her Excellency Saida Muna Tasnim, Bangladeshi High Commissioner to the UK, present here, as well as Dr. Nikki Khanani, National Director of Clinical Integration, NHS England. So really delighted with the array of speakers that we've got. It's a great opportunity to learn about Bangladesh. Far too often Bangladesh gets missed out historically. Today is the time to level that up. We're addressing that. We're talking about Bangladesh history in the midst of South Asian Heritage Month. And we have got the director of Tower Hamlets, Public Health Director, Shuman Banerjee, who will be talking now about Tower Hamlets and health and Bangladeshi communities in Tower. So without further ado, I'd like to introduce Dr. Shuman Banerjee. You have the floor, and thank you very much for joining this illustrious lineup. And we're really delighted that London Borough of Tower Hamlets is here with the largest Bangladeshi population in London, if not the United Kingdom. Thank you.
Great. Thanks very much, Riyadul. And hopefully people can hear me. Okay. Great. Yes. Brilliant. So I'm Shuman Banerjee. I'm Director of Public Health in Tower Hamlets. I just want to say a little bit about my background. My father was from Kumila. My mother was from Chittagong. They moved to Kolkata after partition. They met in Glasgow. We grew up in northwest London. When my father died, he had extensive heart disease. He wasn't a smoker. He looked after himself okay. So, you know, the clinicians were a bit puzzled, but kind of reflecting on it, we all know that one of the biggest risk factors for heart disease is actually stress. And my reflection on that was that the sort of accumulated impact through his life of coming to this country with nothing, having to raise a family, earn money, growing up in a country which was sometimes hostile, the experience of racism, National Front, BNP, I think all of those things contributed to his condition. And I think this is a very typical story that plays out in Tower Hamlets and elsewhere. Just get the next slide, please. So just a little bit about Tower Hamlets. In Tower Hamlets, there's the population is about 310,000. There's around 84,000 people of Bangladeshi origin within Tower Hamlets. 56% of those are in the two most deprived quintiles in the borough, and that's the highest proportion in the population. If you just move on to the next slide. I just wanted to share some of the health statistics that really highlight the health inequalities that face the Bangladeshi community. So what these graphs that I'm just about to show how likely it is for different ethnic groups to experience particular health conditions. And I'm sure we'll share these slides later so you can have a sort of closer look. But the top line is, if you look at a really common condition like diabetes, at the age of 70 in the Bangladeshi community, the chance of diabetes is 1 in 2. That's compared to 1 in 4 in the rest of the population. And this, if we can just quickly go to the next slide, please. Similarly, with high blood pressure, which is a really important determinant of health and the risk of heart disease and stroke, at the age of 70, the chances of high blood pressure in someone from the Bangladeshi community is 1 in 2 compared to 1 in 3 for the rest of the population. Next slide, please. And so in terms of heart disease, if we think about the sort of 55-year age band, the chances of being diagnosed with heart disease is 3 times higher than the rest of the population. And the next slide, please. And then this one it's a condition that's not always considered commonly, but kidney disease it's also a consequence of high blood pressure, diabetes, and those sorts of issues. And so in the Bangladeshi community, by the age of 70, around 1 in 5 is likely to be diagnosed with kidney disease compared to 1 in 10 of the rest of the population. So that really highlights the extent of some of the health inequalities that face Bangladeshi communities in Tower Hamlets. These are 6 principles. I'm just going to go through them really quickly, which are the things that the community say matters to them in terms of how we build our health and care services. So just resources should support the health and supporting health and well-being should go to those who most need it. And I think that one of the key things about that is when we think about resource allocation, we need to think about ethnicity as well. The second one is about feeling connected. And actually what we find in Tower Hamlets is how important it is to connect people around their health conditions to help each other support and manage their health. The third one is about being treated equally and without discrimination. And there was lots of, through COVID, there was a lot of discussion that came through about the experience of Bangladeshi communities and other communities going through health services, and it really highlighted how services need to be redesigned in order for people to feel safe and respected. Really important message from COVID as well was the importance of developing the health messages that we had, whether about testing or vaccination, that they should be designed with community so they land in the way that we want them to. And similarly, people were saying that they felt that they wanted to have more power in shaping and designing their services. Finally, how we make the best use of the assets that we already have. A really good example of that in Tower Hamlets is when initially the Bangladeshi community in the first wave of vaccination, their uptake was relatively low. And then after a few months, it was actually amongst the highest in the borough. One of the things that we did was we used the mosque as a vaccination centre. And that was important because actually it was well taken up, but it was also an important signal that signalled trust in the vaccine programme. Last slide, please. Thanks. So just 3 reflections from COVID. So if what would it look like if we responded to these pandemics of non-communicable diseases like heart disease, diabetes, with the same urgency as we did for COVID? During COVID, I knew in every sort of housing estate where the cases were, but I don't have that sort of information for some of those other conditions. The other message I think that's really important is about how we track ethnicity in our systems. It took a long time for the inequalities and the disproportionate impact of COVID to actually be surfaced through the system. So we need to think about that, where the data is used, and even where it's collected, it's not used as a matter of routine. And then finally, I just wanted to say the most important message, I think, from COVID was that we're only successful insofar as we understand and we're connected into the communities that we serve and that we develop solutions together. And I think that is clearly in addressing the inequalities, which is obviously the theme of today. This is the direction we need to go. And that's why I'm really, really delighted that this network has been established, and it can only be an asset for communities across London. So thanks very much.
Thank you very much, Dr. Banerjee. It's really, really, really insightful presentation. So today, with this important launch of the London Bangladeshi Health Partnership, it just shows you how important the ask is and what we can do collectively in London with all the stakeholders regionally and across all the boroughs to disseminate good learning, share good practice. But before I do that, I'd like to just discuss how the London Bangladeshi Health Partnership came into being in the first place. And this basically started from a position of understanding the learnings from COVID, and we learned that we need to look at and address these health inequalities that Dr. Banerjee talked about, and that would be instrumental in the development of this partnership. The COVID vaccination campaign in itself was successful because it mobilized that kind of multi-stakeholder partnership working right across London. And so where I work in Enfield, in the borough of Enfield in London, this looked like kind of joint working between public health and acute and community trusts, the ICB, primary care, PCNs, GP Federation, pharmacy, and the voluntary community sector, the richness of that sector. And then we mobilized, as Zaman referred to earlier, an immunizations, vaccination, screening inequalities group that I co-chair with the Director of Public Health. Then we decided, following the maturity of the vaccination program, to extend the learnings at place in Enfield from COVID-19 to address and tackle childhood immunizations and screening initiatives. Next slide, please. And then from looking at place, we looked at London and nationwide. I'd learned there were so many webinars from NHS England in terms of COVID vaccination, sharing best practice from one place to the other. I learned a lot from that. There was the London Health Equity Partnership, and they had mobilized the London Health Jewish Partnership, the London Muslim Health Forum. All these particular forums are very, very useful to understand good practice. And then there was also this very pivotal London-wide Bangladeshi webinar that Her Excellency, the High Commissioner, attended on behalf of London councils and Camden councils with Professor Kevin Fenton and other notable Bangladeshi diaspora colleagues. And that actually kind of got me thinking about the idea that maybe we need to look at the Bangladeshi community and work collaboratively in partnership with them at a kind of London-wide level. At the same time, I was appointed Core 20 Plus Ambassador. That's and I'm not medically qualified. I'm a public administration graduate. I work in health policy and I deliver health for the betterment of our communities. But I take an important understanding and role and inspiration from my medical and clinical colleagues to help them deliver their positive health outcomes for our residents. And so I've also got involved in the business of health inequalities. And then I thought, well, how do we apply all this for the benefit of Bangladeshi Londoners? And we know from COVID, and painfully for our community as well as others, how COVID discriminated against and disproportionately affected Bangladeshi community. And there's not a single family that has not been indirectly or directly affected by COVID in many Bangladeshi households. And then it's about those underlying health inequalities. So what we did, I kind of worked through kind of digital media, through LinkedIn and Twitter, and I built a regional interdisciplinary group of allies, people like Zaman and Dr. Sharmin and others that were kind of health and community development specialists interested in understanding more about the Bangladeshi health community and what we can do at scale. And then came the kind of fusion of this. I connected with London Health Legacy and Equity Partnership to mobilize and co-deliver this at scale. And this is where we're at, really. And this is why this meeting is here. We're launching this London Bangladeshi Health Partnership today. It's come into being by getting this group that is diverse, united in the interest of wanting to deal with health inequalities, but recognizing how important it is to work in partnership with the communities that we serve in Tower Hamlets, in Newham, in Redbridge, wherever Bangladeshi communities reside in London. We need to work in partnership with you. We must not assume anything. We need to understand so that we can better deliver for you, for all our London residents. And so this Bangladeshi Health Partnership is this kind of amalgam of these key health partners with the Bangladeshi community organizations and representatives to support the development strategically and operationally to respond to the healthcare challenge of the Bangladeshi community and kind of really try to address kind of health inequity, like, for example, in regards to access. Now, this is a key program within the Legacy and Health Equity Partnership program, and LEP itself is NHS funded. It's a multi-stakeholder program for London that builds on the lessons from COVID with a vision to mitigate against health inequalities in screening and access to health. And as I said before, LEP has many programs of work, and I'm very delighted that the London Bangladesh Health Partnership is right in there in the midst of all these programs. And let's see, that we need to work with you all to make it a reality. We need to go beyond lip service. We need to go to action. So thank you again. I'd like to now hand over and warmly welcome Dr. Sharmin Shahjahan. Sharmin is a Deputy Director for Voice for Change England, and she's the co-chair of the London Bangladeshi Health Partnership. And what she will now discuss is where now next to go for the London Bangladeshi Health Partnership. What are our priorities? What are our aspirations? You know about the issue about health inequalities. We've discussed about where the partnership was, how it came to being. Now we can talk about how we can collectively go forward. Dr. Sharmin, over to you. Thank you so much.
Thank you, Riyad. As Riyad mentioned, we met before we came into being. We are launching it today, and collectively we co-designed what the priorities would be for the next steps for this partnership. And diabetes, as Sherman mentioned, is quite prevalent in the Bangladeshi community. So diabetes prevention, management and awareness is a priority for this group. And also hearing and responding to community priorities through focus groups and insights to inform immunizations and vaccination and kind of screening uptake. And also there are emerging, priorities that would arise from hearing and responding to, kind of communities. But that's where I think the added value of this partnership is. We are working towards health equity because we are utilizing the insights and experiences of the London Bangladeshi Health Partnership members that will enhance better engagement with the communities and faith groups, faith networks. And we can't, we have to work with our key community leaders And we have the intelligence, and we know what, what will work. How do we engage with our community? What approaches worked and what approaches it wouldn't work. We've tried before. So it's a very tailored approach in community engagement we need to employ. Also, doing that would achieve an effective and fast outcomes because we got very expert and intelligence within the partnership. And that would enhance the learning for our future work and priorities. And that would support the NHS and our other relevant colleagues and different agencies. So it is very much a multi-sectoral or multi-agency approach. Collectively, we'd like to address health inequalities in the Bangladeshi community, but also COVID has taught us and has magnified the existing health inequalities in the Bangladeshi communities, and I can't underestimate the wider determinants of health that have existed. So we need to address this collectively for the next steps, and I would, welcome and look forward to all the, speakers at least to work with us to make it a success. Thank you.
Thank you, Sharmin. Thank you so much. And now I have the absolute privilege to introduce Her Excellency, the High Commissioner of Bangladesh to the United Kingdom and Ireland, Ms. Saida Muna Tasneem, the Bangladesh High Commissioner. She will be giving our keynote address today to launch the London Bangladeshi Health Partnership, talking about recognizing the contribution, the historical struggles of Bangladesh, the contribution of British Bangladeshis in this country, and to the NHS. I'd like to give the floor to Her Excellency, and again, warmly welcome her to this audience today. Thank you so much, High Commissioner.
Thank you. I'm trying to join from my laptop because I've just entered my office. I was actually in the car at that point. Could somebody give me access? Because I'm trying to get access to another Zoom link from my desktop. So if someone could give me access there, it'd be very nice. Thank you. I'm just joining there. And then I'll switch this one off.
Your Excellency, you now have access.
Yes, you can see me?
Yes, we can see you.
Sarah, perhaps you can spotlight Her Excellency.
Recording in progress. Progress.
Hello, everyone. Can everybody hear me and see me?
Yes, yes.
Thank you very much, Dr. Riyad for Mr. Riyad for inviting me. I would like to thank. I was actually coming back from a meeting, so I was listening to some of the statements made by previous four speakers, and I'd also like to thank Mr. Kasru for inviting me here and introducing me to Mr. Riyad. I know that both of you are not doctors, but you are working. Mr. Riyad is working for NHS, and Kasru Zaman is a community person, and I would like to congratulate both of you and everyone who's involved with the London Bangladesh Health Partnership for creating such a partnership. I think it was much, much needed. I was just listening to different, perspectives that were given by Dr. Sharmin and also Dr. Shuman, and how the profiling and the need for such a networking project or a role model project or best practices from different parts of the world. So I'd like to congratulate everyone who are involved with the London Bangladesh Health Partnership Initiative. of course, this is the month of South Asian heritage. And I would just like to take that how enormously proud I am to be High Commissioner here in the UK, where, South Asian heritage probably is one of the richest from the perspective of UK's history. And in that context, I would like to pay tribute and profound homage to our father of the nation, Bangabandhu Sheikh Mujibur Rahman. As you know, in 2004, BBC ran a survey, and the survey was about who's the greatest Bengali of all time. And there's a long list of South Asians who are of Bengali origin from India, Bangladesh, Pakistan, and then, of course, from overseas. And everyone voted Sheikh Mujibur Rahman, who's the founding father of Bangladesh, the greatest Bengali of all time, because he actually, based on Bengali nationalism, created a state called Bangladesh in 1971. So when we talk about Bangladeshis, actually, I'd like to refer to them about the Bengali heritage here in the UK. And I was listening to this Dr. Shoman, whose father is from Kumilla or Chittagong, and from East Bengal. He then went to West Bengal. But at the end of the day, the Bengali British community, who started settling here from early 20th century, right after the First World War. And then on, 60s, 70s, they established, they started coming as professionals, and particularly doctors, something that the NHS should take pride in. And we've had Bengali British doctors working at the NHS from the 50s. I was just mentioning that the other day, High Commission honored on the occasion of birth anniversary of our, Begum Mujib, a doctor, Dr. Halima Begum, who was a gold medalist from all over the East Pakistan, between 47 and 71. I'm talking about that time, that period. And she came here, she graduated in the 50s, and she became a GP here in the 1963, one of the earliest, and I wasn't even born there. So these are the women that we take great pride in, and could say that, they represent South Asian heritage here in the UK, and also from gender perspective, how South Asian women and Bengali women led the way. And there are other women doctors and male doctors who, Mr. Riyad's father is a doctor. He came here in the 70s, I've heard. And there are many. So in the 60s, we saw a growth of Bengali doctors who were top students, kind of a brain drain, but, they came here for higher studies with gold medalists and with full scholarships. They became GPs, they never went back. And, that their next generation, Dr. Halima's sons, they're also doctors. So there's this generation of doctor-making families. And this practice, I'm sure, goes on in other South Asian communities as well. So therefore, I'd like to pay a tribute to all the doctors that have contributed in the NHS from Bengali heritage. And then in 1971, Bangladesh became independent through, under the leadership of Bangabandhu Sheikh Mujibur Rahman. And I would like to pay my tribute to him because this is the month of mourning when he was assassinated in 1975. But then, he's been a great inspiration for Bengalis here, because Bengalis Bengali, Bangladesh, the Bengali British, they always believed in a nation state, a sovereign nation state based on Bengali nationalism. So that is very much a factor, how the nearly 1 million strong British Bangladeshi diaspora here connects to Bangladesh and their Bengali heritage. It's important to mention here. So according to the ONS 2022 survey, there are 800,000 British Bangladeshis here. And in addition to that, about 150 have moved in from Europe. And these are, European Bangladeshis who have actually exited EU before the Brexit happened, the 31st December deadline. So we are also, from the High Commission, we cater to that community as well. I really don't know what is their status, whether they're European, because, I know we have the European passports here where we give some citizen services. But we know that all of them actually fall back on the NHS. NHS is something that the United Kingdom should be very, very proud of. United Kingdom has the NHS. Bangladesh doesn't have an NHS. Every developing country in the world aspires to have a universal healthcare system and something like an NHS. Therefore, when I go to, if I go to my GP, in our diplomatic lifestyle, we quite often end up going to private hospitals. But, I do try to go to my GP to the extent possible because I don't enjoy going to doctors. But, coming back to the heritage, I would like to, first of all, pay a tribute to all the doctors, nurses, and everyone that works for the NHS to save lives, and those who have given their lives during NHS, saving other lives during the COVID pandemic, and all the Bangladeshi doctors that have been in the front line in emergency services, including Dr. Faisal, who was one of the first ones who wrote to Prime Minister Boris Johnson. The doctors at the NHS emergency were working without personal protective gears. And, he actually gave his life. So I'd like to pay a tribute to him. And also, Dr. Fazana Hussain, whose face was on the, many of the NHS boards, who's a British Bangladeshi doctor who from Newham, who got the GP of the Year award in 2019. And when NHS was celebrating 72 years or so, just during the COVID, her face was everywhere, and we all knew she's a British Bangladeshi doctor, and we felt so proud. So, we feel proud of her. Then, Dr. Naeem from NHS, Dr. Jahangir, who worked with vaccine. So, all the doctors, and I know there are about 1,300 Bangladeshi doctors, British Bangladeshi doctors in the NHS. I would like to pay my tribute to all of them and to everyone at NHS. Now, coming back to, I was listening to some of the conversations about inequality, profiling. Generally, during the COVID, I was invited to the number 10 for 2 dialogues. And these were dialogues organized by advisor to the Prime Minister. And the conversation was about, the first one is about why are more Bangladeshi people being affected by COVID, and the seniors are dying or getting more COVID. And then the second one was, why are not Bangladeshi people taking enough vaccines? Now, on both occasions, I disagreed, because during the COVID from the High Commission, we created this, WhatsApp doctors group and a 24/7 helpline. So that the British Bangladeshis can reach out to the High Commission, and we created a doctors panel. And we encouraged our community to reach out to us for even if they have a breathing problem, so that we can connect them to the NHS doctors. And we had NHS emergency doctors from British Bangladeshi community working in the emergency. And they told us that, Bangladeshis are fully aware of the, it could have happened like they were living in joint families and senior members got the COVID from junior members, and they couldn't survive. So because of the family structure and the culture, it may have happened. But, Bangladeshis did take the vaccine. So each time I went to number 10, disagreeing with whatever they were saying, because I said my community is not really dumb. They know exactly what is good for them, what is bad for them. And again, coming back, the NHS doctors and experts could bear me out whether it is true. But I know that, we have heard that during the NHS, during the COVID, many senior citizens from British Bangladeshi community had passed away. And they said that, they felt that there wasn't enough space at the NHS. There wasn't enough days that they could spend in the bed in the NHS. So there was this dearth of, resources. And I know that Prime Minister Rishi Sunak, who's of South Asian heritage, and I do pay a tribute to him. It's wonderful to see a South Asian heritage Prime Minister. So, and he's taking so much interest in NHS, and he's trying to clear up the backlogs. These are good initiatives that he's taking. And I know that there are demands from NHS doctors and nurses. And I know there's a huge dearth of, there will be a crisis of doctors and nurses. There's already a crisis of nurses. And I know that there will be also a demand for doctors. So coming back to British Bangladeshi doctors, compared to other South Asian doctors such as India or Pakistan, Sri Lanka, Nepal, we really have very few numbers of Bangladeshi British doctors. And I would encourage the NHS to recruit more, British Bangladeshi doctors. I really don't know the equation here. How is it done? But we'd like to see more doctors of Bangladesh heritage at the NHS. The other thing that I'd like to mention is, about universal healthcare. Is that Chatham House has created a universal healthcare commission headed by Helen Clark, the former Prime Minister of New Zealand. And we have an expert from Bangladesh there, Ms. Saima Wazet. She's the expert on, she's the commissioner there on mental health and how to bring mental health into universal healthcare. And I think mental health is also a very important aspect that Bangladesh is taking leadership globally. And I'd like to see our community and the London Bangladesh health compact, the partnership also to address the mental health issues of our community, because quite often, we have women coming to the High Commission needing help from the community. Either they have been divorced or they have a child custody problem, and they go through a lot of mental issues, and we can see that. So that's an important aspect that I'd like to request you to take in. I know my time is limited. I would like to again mention that in 1972, when Sheikh Mujibur Rahman came to the UK, British Bangladeshis, before that, during our 1971 Liberation War, it was the British Bangladeshis that organized the Trafalgar Square demonstrations, starting from Hyde Park to Number 10 and Trafalgar Squares. And they had 3 placards at hand, and many British and South Asian, particularly Indian community, because, of course, we're fighting with Pakistan. So India came into Bangladesh's support. And here also the Indian diaspora, the members of parliament, and the British Labour Party, Conservative Party, everyone supported Bangladesh's liberation war. And the British Bangladeshi community took a leadership, and the placards were "Stop Genocide in Bangladesh, Recognize Bangladesh, and Release Sheikh Mujib." So I'd like to pay a tribute to our British Bangladeshi diaspora. Today we have 2nd generation and 3rd generation doctors at the NHS, but also side by side, the Bangladeshi British catering community. The curry industry is also a very strong backbone. During the COVID crisis, I would like to acknowledge that the curry industry and the restaurant owners, they provided so many free meals to the NHS workers. I know that I was invited to so many on social media. I followed that, and I think they've done a great job in supporting the NHS, apart from giving charity to many, free meals and all that, but they have supported the NHS staffs and always acknowledging their appreciation. So in the High Commission of Bangladesh, I taking pride again in our British Bangladeshi doctors, nurses at the NHS, but also again reiterating my appreciation for the NHS. Every country wants to have an NHS, and the UK should be proud of its NHS and all the people that work for it. Thank you very much.
Thank you so much, Your Excellency, and thank you for your warm words and appreciation of the NHS, and a great sweep through the history and contribution of the British Bangladeshis to this country. Thank you so much. And we hope that you can stay for the panel as well later on. I'd like to now move over to my colleague Bashir Uddin, who's on the steering group. He's the Chief Executive Officer for Bangla Housing Association, and he's now going to talk about very much a segment about lived experience, the London Bangladeshi story, a reflection of his personal story as a 1st generation Bangladeshi immigrant. Bashir, the floor is yours. Thank you so much.
Thank you very much, Riyad Bhai. Assalamu alaikum and welcome everybody. I'm going to first of all start off with a reflection on my personal journey as a 1st generation Bangladeshi immigrant. I was 11-year-old when I came to this country in 1966 to join my 2 uncles in Mostly, a small mill town in Lancashire. I was the first Bangladeshi boy to arrive in this town and go to school. Although some of other Bangladeshi boys arrived later, they were sent to work as soon as they reached their working age. But my uncles allowed me to go to college after I finished school. As my English improved, I became the unofficial interpreter for the Bangladeshi men who could not speak English. In 1981, I went to Bangladesh to get married. I got my first job in 1982 in a community center in Rochdale. I moved to London in 1984 with my wife and our 2 children, as I was offered a job with the GLC as a bilingual receptionist in a housing office in Tower Hamlets. 1 year later, I was tempted to go and work for an East London Housing Association as they needed a Sylheti-speaking housing officer, and later I was promoted to team leader. In 2004, I took up my current position. As for the early Bangladeshi immigrants coming to UK and London, after the Second World War, some of the Bengali Indian men working in merchant navy took refuge and settled near the docks in East London. They mainly came from Sylhet, Noakhali, Chittagong districts in East Bengal. However, in the late 50s and early 60s, a significant number of young men from the then East Pakistan began to arrive in the UK with work permits issued by the British government. Most of them coming from the rural villages in Sylhet district of East Pakistan, which is now Bangladesh. On first arrival, I felt that this is a completely different country to where we came from. And it was so cold in winter that you had to burn coal or use paraffin heaters and even take hot water bottles to bed to keep warm. None of us could speak English and have no knowledge of English customs or culture. We were missing our families and relatives. The only way we kept in touch was by letters. Back at home, everyone knew each other in the village, but here we didn't even know who our neighbors were. The Bangladeshis were living in cheap, private rented accommodation with very basic facilities. We had to sleep in cramped rooms, often using outside toilets and going to the public baths, as there was no washing facilities at home. First, I thought that everyone, including the English people and their families, lived like this. But I soon realized that they were living in much better, well-furnished homes with good washing facilities. After I visited some of my schoolmates' homes, when someone came to this country for the first time, they would come to live with a relative or someone they know from their village. Those who were already here treated the new arrival as a brother, provided food and give him pocket money until he secured a job. Getting a job was not a problem, as there was plenty of manual jobs available in the mills and factories. These young men were willing to work long and unsocial hours. Their intention was to work hard, earn enough money, then go back home and live with the family in the village for the rest of their life. Connections to Bangladesh. I know some people who went back home after being here for a few years and decided never to come back. But for most people, it was a different story. After they went back home and spent their hard-earned money on building expensive houses and buying rice fields, their savings soon exhausted. So they returned to the UK. In the villages, their families were relatively well off, and the villagers would refer to the expatriate as Londonese, and his village home as Londonese Bari, even if they lived anywhere in the UK. Bangladesh Liberation War. During the Bangladesh Liberation War, the community came together. They set up the Bangladesh Action Committee in London and other cities, campaigning against the brutality of the Pakistani army and building support for the freedom fighters. We were very distressed hearing about the atrocities being inflicted by the Pakistani army to our loved ones. My father was killed by the Pakistani army because he wanted to protect Hindu families in our village. My uncles and their friends donated their full week's wage packets to local action committee supporting the freedom fighters. I remember coming to London with hundreds of Bangladeshi men in a convoy of coaches from Oldham and surrounding towns to join the thousands of people from London and other cities at Trafalgar Square rally organized by Bangladesh Liberation Action Committee on the 1st of August 1971. Slide two, please. Families coming to UK and London. In the 1960s, late 60s, some of the men brought their families in this country. But most of the families arrived here following Bangladesh Independence War in 1971. As the men brought their families, many of them decided to live in and around Brick Lane in East London, even if they previously lived outside of London. They felt their families will be safe here, and their relatives and friends who were already settled here were willing to share their homes with them, even though they themselves were living in cramped flats. This led to high demand for council housing. The council had to resort to placing families in temporary B&B accommodation. Challenges and racism faced by the community. Some people in the host community were upset with the situation, as they felt that the new immigrants were taking their homes and jobs. Also,
oh, there are some background noise. I'm sorry, can you please mute everyone else? Thank you. Apart from Bashir.
Bashir, if you unmute yourself. Apologies, we're just going to get Bashir back. Bashir, if you could unmute. Thank you so
sorry,
much. Thank you.
somebody muted me. Sorry about that. Okay, I'll start again. The challenges and racism faced by the community. Some people in the host community were upset with the situation, as they felt that the new immigrants were taking their homes and jobs. Offers of flats in Bow and Poplar and other areas initially were rejected, as their new flats were painted with racist graffiti, even before they moved in. The National Front marched through Brick Lane, perpetrating hatred and violence. The community felt threatened with the increase in racial attacks. Fight back and standing up against the racists. In June 1978, the racist attack and murder of Altaf Ali in Whitechapel and the killing of Ishaq Ali in Hackney galvanized the community, especially the youths, who brought out hundreds of people demonstrating in Brick Lane and Hackney, demanding action from the police. Bangladeshi youths, with the support of their white friends and sympathizers, fought back and stopped the National Front from coming back to Brick Lane. The housing authorities had to change their policies to accommodate the needs of the Bangladeshi community, employing bilingual staff to support residents and victims of racial harassment in the estates. I joined this workforce in December 1984. Bangladesh's contributions to the UK and London's economy and society. Over the past 30 to 40 years, the Bangladeshi community has made great strides and has been accepted as a major contributor to the betterment of the London society. Our second and third generations are choosing to go to university, securing good jobs in all sectors of the community. Personally, my two daughters are primary school teachers and my son is a journalist. Young Bangladeshis are also getting involved in politics, sports, and civil society. The curry industry, mainly pioneered and run by the Bangladeshis, even though they were known as Indian restaurants, is a major contributor to the British economy. Chicken tikka masala became a household name and popular choice of dish for the English people. There are now probably more mini cab drivers and bus drivers in London from Bangladeshi community than any other BAE communities. And a significant number of Bangladeshis now work for the NHS and private healthcare agencies. Last slide. COVID-19 pandemic. Sadly, COVID-19 pandemic disproportionately impacted on the Bangladeshi community, as they were 2 to 3 times more vulnerable to the coronavirus than the white community. There are many issues that made the community more vulnerable to the coronavirus. Some of these issues are due to structural and long-standing health inequalities existing in our society. The community and the BHS response to COVID-19. During the pandemic, many Bangladeshi individuals and community organizations supported the community by delivering food parcels to vulnerable families and helping with funeral arrangements for bereaved families during the lockdown. Community TV channels run programs with the health messages. Bangla Housing Association supported the community by delivering health messages using translated leaflets, videos, working in partnership with the NHS and public health teams. Nearly finished. London Bangladeshi Health Partnership. I'm pleased to be involved with the London Bangladeshi Health Partnership so that we can work together to address the health priorities of the London's Bangladeshi community and challenge the structural health inequality that exists in our society. Thank you very much for listening.
Thank you very much, Bashir, and really very important lived experience segment there. Thanks again. Ladies and gentlemen, please also take to the Q&A for any questions that the panel will deal with in the next section. Now, I'm really delighted now to bring a strong triumvirate here of senior people that are working in health inequalities in the NHS. So I would like to introduce Dr. Leonora Whale, who's the Director of NHS London Legacy and Health Equity Partnership and is Public Health Consultant at AXA London. I'd like to welcome Minara Chowdhury, who's the Senior Director of Global Delivery Institute for Healthcare Improvement in the US. And we're really delighted today as well to warmly welcome Dr. Nikki Kanani. Does she need any introduction? We've seen her so many times during COVID, take the rostrum and take the leadership and really reassure people in the front line and communicate the message to the communities about the importance of taking the vaccine. I'm really delighted to introduce Dr. Nikki Kanani, MBE, who's a GP at, first and foremost, is a GP at St. John's Medical and she's the Director of Clinical Integration, NHS England, and Deputy Senior Responsible Officer for the NHS COVID-19 vaccination program. So we've got a very interesting health inequalities section where we're going to go next in terms of getting health equality for Bangladeshi Londoners. Thank you again. The floor is yours. Leonora.
Thank you so much, Riyadh. Thank you for the introductions, and it's an absolute honour to be here today. And I think whilst our segment is around inequalities, it's been a real clear thread throughout all the talks today. And this is, of course, is in the context of the health system and health partners recognising the disproportionate impact that COVID has had on many communities, which we've heard today, and highlighting existing health inequalities across London. And this has strengthened the need to really build on those lessons and the legacy and the leadership in this space to ensure absolutely that no community is left behind. So key to this approach and our learning is ensuring that we support communities around their health, that they are at the centre. And with this, there is a need to lead by their needs, to build their trust, to work with them, and that health partners listen and respond and recognise that each community will have their own journey and therefore need a unique approach. But also within all those different communities, everyone will have their own story, their own London story, like we heard from Bashir today. And that's why it's so important that we have the launch of the London Bangladesh Health Partnership to ensure we're working collaboratively to reduce health inequalities for the Bangladeshi community. So we've got two slightly different perspectives today, slightly different framing. Delighted to introduce Dr. Nikki Kanani to really talk about the threat that we have for London at the moment being so important, that the measles outbreak that we have. So Dr. Kanani, over to you.
Thank you so much. And first of all, can I just give my real appreciation for you, for colleagues for having me, but also for all of you joining. This is such an important session that we're having today, and I'm very proud to join. I've been really lucky working with Riyadh over the last few years, both on vaccine uptake, but more in depth on kind of how we best work with and learn from a Bangladeshi community to make sure that our health services are set up in a way that are genuinely accessible. We've got a lot, we've learned a lot, but we've got a long way to go. Leonora, thank you for the introduction. I think I'll probably just flag a couple of what I think are really important points, and then happy to have a further conversation around any of the points that that we cover in the next few minutes. So we mentioned measles. And maybe this is a strange place for me to start, given my last few years working very closely with and for the COVID vaccination programme. But as you know, this is part of a wider suite of things that we need to do to protect our communities, whether that's flu vaccination, polio in London is something that we've been thinking about very deeply, RSV, respiratory syncytial virus, which is a respiratory condition that children get. So our ability to learn from the vaccine training program to really understand what works for communities, and then plug that into other areas of care is crucial. So this is our opportunity to talk a little bit more about measles. So if I tell you a little bit about it and sort of some of the things that we should be considering for our Bangladeshi community, and for you to take through into your own spaces as well in terms of amplifying the message. So our cases for measles are really rising in England, and UXA, our health security agency, have announced that in London particularly, the risk of the increasing number of measles cases is really high. So between the beginning of this year, the 1st of January, and the 30th of June, there have been 128 confirmed cases of measles, compared with 54 in the whole of 2022, and 66% of those cases have been
Apologies, I've just lost Nikki there. Nikki, are you there with us?
been detected in London, although we do have this as a real, but what we can do now that can make a difference. Over the last 10 years, oh, we're being recorded. One of the things that is really prescient there is that uptake in London is the lowest in the country. So in some areas of London, up to 2 out of 5 children are not fully vaccinated against measles with both the doses of the MMR vaccine. So that means our children are at higher risk of catching measles, the disease spreading, and just one person with measles can infect 9 out of 10 people who have not had an MMR vaccination. So particularly where you've got a community that might not be able to access the opportunities to get vaccinated, or we're not offering it in the right way, you know, this can be a real concern, and particularly for measles, because measles isn't just the rash that we sometimes talk about, but it can cause meningitis and sepsis, a real risk to life. And as there's no treatment, once somebody is infected, often 1 in 5 cases will require a hospital visit or admission. So it's completely preventable is the good news with the MMR vaccine, and 2 doses provides over 99% protection. And since the vaccine was introduced in the 1960s, over 20 million cases have been avoided. So very much more than what we've achieved with COVID vaccination, and even that has been incredible. So that alone has saved over 4,500 lives, the MMR vaccine, or the measles vaccine as a whole. So just to recap, young children are offered 1 MMR vaccine after their first birthday, and the second is around the time school starts, about 3.5. And that's because 2 doses provides the best possible protection against measles, as well as mumps and rubella as well. We know that the World Health Organization sets 95% MMR vaccine uptake as the level to create herd immunity. So that's really the level that we really have to ambitiously head for, because it's highly infectious, and it can be spread before the rash even appears. So you'll be thinking, why am I talking about this, particularly for our South Asian communities? Well, it's particularly crucial for us. It's important for all children and adults in all communities to be vaccinated with both doses. But in South Asian communities and in some South Asian countries, we see really high rates of measles. And then when we get travelling as well, which we all do, we particularly without having full vaccination, it can really put children at risk of catching measles, and sometimes we see uptake being slower in our communities as well. So again, as I said at the beginning, some of the things we've learned from COVID vaccination, we really need to learn and embed for wider vaccination opportunities. So I guess my last couple of points, Leonora, are a real call to action, please. So please check your child's Red Book to make sure your child is up to date with their vaccinations. And if not, make an appointment with your practice to make sure that you can catch up with any missed doses. It's genuinely life-saving. And do contact your own practice to check your vaccination record and to make an appointment to catch up on any doses that you might have missed or any concerns you have. And for more information, we've got lots at nhs.uk/MMR. And I hope that gives you enough sort of context. I think, you know, just back to the journey that Riyadh and I have had, we've been able to do so much over the last few years when it comes to vaccination uptake for COVID. some of the fantastic kind of examples around the influence of videos. That's not the bit that Riyad and I did, but working with healthcare professionals as well, Fazana, Dr. Alom, Dr. Ahmed, Naeem, but also, you know, getting into hyperlocal communities to make sure that we really target our Bangladeshi communities and friends in Tower Hamlets, in Newham and Luton. You know, we want to make sure that we learn from all of those things to make sure that our Bangladeshi communities get the best support and the best opportunity to be healthy, and for that, you know, so that our NHS can learn and grow and make sure we serve our communities in the best way possible. So thank you, Leonora, and I look forward to learning with colleagues on this call, and more so over the duration of the session. Thank you.
Thanks so much, Nikki. And I think absolutely, in terms of talking about the best opportunity for working to improve the health of our community. So Minyara, turning to you now, from a health improvement lens, what are your thoughts really about health inequalities amongst communities and what that means in particular in the context of the Bangladeshi community?
Thank you so much, Leonora. And it's so good to hear such amazing talks from people. And Nikki, the focus on measles, I think, is so critical. So really just wanted to share some perspectives at perhaps a slightly more national level, and then moving into what this means for London Bangladeshis. And being from the British Bangladeshi, I think it's so important to think about what are the key diseases, what are the key conditions or clinical areas that the national arena is focusing on, and then how that translates to us. So maternal care, Core 20 Plus is a major NHS program that's really dealing with inequities and inequalities in healthcare, thinking about maternity and severe mental illness, chronic respiratory disease, early cancer diagnosis, and hypertension. And Your Excellency, was so good to hear about the work that's happening in Bangladesh on mental health. And I think, you know, this is something that we really need to focus on here as well within the UK. From a children and young person specifically, looking at asthma and diabetes, epilepsy, oral health is something that's really close to, I think, a lot of people, and thinking about dental care, and how we get better access to that. Actually, my own daughter-in-law works within the dentistry profession. She really talks about how important it is to think about oral health, and especially within children. And again, mental health is really important there. Next slide, please. So what about British Bangladeshis living in London? So we know that as at 2021, there were 322,000 Bangladeshis living in London, with the highest concentration in Tower Hamlets, Newham and Redbridge, Dagenham, Barking, Dagenham and Camden. So how are we really thinking about their health needs, and what are those priorities? We obviously have heard about the impact of the pandemic, which is just been so profound, and we've learned so much from the pandemic, and we heard Her Excellency talk about it, we've heard Riyad talk about it, and I think that's really important. It really helps us to understand what those health priorities are. Thinking then about diabetes, how do we help our community to really understand how to care for oneself and the families and the community in diabetes? Mental health, obesity is, again, very high on the agenda, and how can we really help our community to think about how we can better manage those conditions? Maternity outcomes, and the London Race and Health Observatory, the NHS, is really working very clearly on maternity outcomes and how we can improve maternity outcomes for South Asians. So there is a chance for us to make a difference, and we can actually, there are opportunities for us as British Bangladeshis to really address the healthcare challenges that we face. There's a factor around modifiable risk factors and greater awareness. What can we do ourselves to make things better? So if we think about obesity, let's think about diet. Let's think about how we can really improve our own health conditions and through better awareness. Therapeutic needs, there's so much more than just taking medication that we need to think about. How do we really think about our other therapeutic needs as we go through the healthcare journey? We've talked about kind of access to specific service, dental, and the waiting times that we all encounter. How do we really think about how we support our community to access services like dental? thinking about the environment, and also health-related behaviours are so critical for our community. And if we can spread that message, if we can really talk about these areas and help our community to grow and understand their own health awareness, I think that's really going to help. And my final slide is thinking about how we can encourage our community to take control of health, but also take control of healthcare, because it's very much beyond the managing the conditions that we now need to think. So Leonara, back over to you.
Thank you so much. And I think you've touched on a few things through your presentation, specifically around mental health, which Excellency touched upon as well, but also screening as part of the Core 20+5. And we have on the call today, Charlotte, who is a consultant in public and dental health for NHS London region. And Charlotte, you lead on your work around reducing inequalities and screening, specifically breast screening. Is there anything key from your perspective that we can just pick up on today around this agenda?
Leonora, I'm sorry, Charlotte's just left the call.
Okay, no problem. Thanks so much. So thanks, colleagues, today, bringing through some of the inequalities. And I think what's key for us to think about in this space is that working within the Legacy and Health Equity Partnership, working with the Bangladeshi Health Partnership, that there is behind all this work, there is very senior leadership in London committed to this work to drive the agenda, all of that with a focus on ensuring that these principles are embedded within everyday working to ensure that no community is left vulnerable with respect to their health. And I will hand back to Riyadh.
Thank you very much. Thanks, colleagues. Really helpful, and a lot of information, key pertinent stuff about measles earlier from Nikki, and a lot of important kind of call to action from Minara and Leonara there about what we can do together to improve Bangladeshi health outcomes and work collectively with the community. So it's really important. As a member of the community myself, British Bangladeshi, it's really important that we're hearing that today loud and clear. We're here to help the community. So now we're moving on to the Q&A panel, and we've got a few questions that have come up. I'll start with one of them, if I may. Okay, and then if anyone in the panel would like to preferably ask and respond to it, that'll be fantastic. Let's start with a question about language barriers. So one request: Bangladeshi patients with language barriers having difficulty booking appointments with GPs. Most of the senior population don't have knowledge of technology or online booking. They're having lots of problems getting appointments. Also, telephone consultations not suitable for non-English speaking patient. The person works for advocacy. Sometimes face-to-face consultation is very difficult for them to understand. Is anyone in the panel would like to respond to that question about language barriers and difficulty booking appointments with GPs and issues to do with technology? So we've got an issue here about digital inclusion, exclusion, and problems in terms of getting access, which obviously is very can be very frustrating when you need to get hold of your primary care staff, etc. So who would like to respond to that in the members of the panel?
I can say something, Riyadh. It's probably your bag as well, isn't it? There's an issue about digital.
If you'd like to come in, I'll come in as well, I suppose, because of I work in primary care, and I can totally understand the pressures on residents and patients. But I would welcome your perspective, Shuman, as DPH.
So my thought is, like, as you know, the system is under a great deal of pressure.
Yeah.
Digital approaches work for some people, but really don't work for other people. I don't think we should be going, oh well, this is all about the pressures on the system. Because I think that, the lessons from COVID are that you have to work with the communities to help people actually navigate what for us is it's a very complex system. In Tower Hamlets, what some of the feedback we get is that, you know, we can't organize, we can't arrange like face-to-face visits. People want to see their doctors and want face-to-face visits. But in actual fact, that is possible. There are ways to get face-to-face appointments, but people don't necessarily know about them and they just give up. So I think there is a lot about working with the communities and actually people, you know, people supporting each other and going, oh, actually, this is how the system works, because it's not going to help us providing like an information leaflet or something like that. It's actually what is going to work for using trusted networks, friends, those sorts of things are really important. And they were really important during Tower Hamlet, during COVID, during the pandemic, because we had to find ways of people accessing, you know, testing centres, vaccination centres. And that was actually working within the communities, working with voluntary sector organisations, networks. Actually, you know, what's going on at London level was also really important. So I think that's part of the answer, but there's no easy answer to it, Ria.
No, I appreciate that. Thanks. I mean, it is quite multi-layered and lots of issues there. But obviously, we want to improve the experience for our residents and patients. I was just wondering if before I chip in, if I could come to Nikki. Nikki, are you still on the call? Dr. Nikki Kanani. Okay, I'll kind of Nikki.
I think, Riyadh, if you can, if I don't think she's here, should we move to the next question? Or if there are any other GP colleagues who would like to add to what Sherman said. Oh, I'm really sorry. Riyadh, can you hear us? Can you hear me? Your screen seemed to be frozen. Okay, I think we have lost Riyadh as co-chair of this partnership. I'm going to take over now until Riyadh joins us again. Shall we go to the next question? Is Riyadh back?
Her Excellency has her hand up.
Oh, sorry, I was looking at the question. Her Excellency, your question, please.
Thank you very much. I was listening to all the conversations and wonderful presentations on measles and inequality and other cultural practices. You know, I see that so many Bangladeshis have joined. Many of them I know from our community. I can see there's a cricket coach called Ratan Bhai. He's joined. He was a cricketer in Bangladesh. I wanted to ask, about, the lovely doctor who presented earlier that, health practice, that means take health control. For me, I've taken my health control because when I call my GP, I only get phone calls. And, it's very impersonal. So I don't feel like going to the GP. I mean, that's an honest confession. But I do intermittent fasting, try to control everything at my age. So I want to stay in the healthy side. But I know that how important sports is to keep, to create the culture from young age, from early age to get into sports. And that prevents, if you have an athlete's kind of a lifestyle, then, we are, like speaking of South Asian heritage and British Bangladeshi heritage, we just awarded 3 young sports person earlier this month. We awarded Robin Dash, who plays for I forgot which county cricket.
Essex.
I think Essex County, Essex County Cricket.
And Dhaka
Essex,
Dominators.
yes. And Nadia Ali, and Dhaka Dominators in Bangladesh. And we've also awarded Hamza Chaudhry, who plays for Leicester City. We present them as role model of young people who really take interest in sports and have really, really excelled. But what is important, we did it. We awarded them so that, other young British Bangladeshis. And my question is, what is the situation in sports in young British Bangladeshis? Are they taking interest in sports? Because this is something that I'm a bit unfamiliar with, because we are trying to collect all this information, but we are doing this incentive and awards. For example, we have an education award, and I know British Bangladeshi children, they're now the 4th toppers, like, 3rd toppers in certain subjects, but, in education, they're Indian and then Bangladeshi students and, South Asian students. But When it comes to sports, we are now trying to give the sport awards from the High Commission to encourage them to get involved in sports. I'd like to know, are they interested in sports? What is the profile there? How can we, and you're talking about the housing inequality, etc. Are there sports facilities, let's say in Tower Hamlets and other places, are community leaders taking interest in them and encouraging young people to get into sports? Thank you.
If I may, I can answer some of the questions here.
Sorry, I didn't catch who where's that coming from? Is that?
Yeah, it's Ratan here.
Oh, Ratan, perfect. Well, Ratan, Mohammed Shahid Al-Ratan is part of the steering group of London Bangladeshi Health Partnership, also CEO of Capital Cricket Kids. You are most welcome, Ratan, to take and add on seamlessly from where Your Excellency's finished.
Yeah, thank you. Thank you to involve me within this important conversation that are so important. Talks are going on, and since the beginning when I joined, and my passion is the sports and young people, and Her Excellency was mentioning about Bangladeshi community and young people. Yes, there are interested young people who are coming out, but the problem is at the moment, Bangladesh population, if we think about England, in London, in England, majority in Tower Hamlets and at the moment in Newham, in this area, and the facility is so poor, I should say. Like in the growth of cricket in Tower Hamlets, become from 2009, 10, 2 cricket club. Now you will have about 20 to 25 cricket club there. But there is no cricket pitches there where there are teams are struggling. We cannot provide an environment for the young people so that they can come and feel confidence and feel welcome. The big Victoria Park, we've been fighting hard through the council to get a cricket pitch there, a grass cricket pitch there where they can play proper cricket on Saturdays, and there can be a junior club. We've been fighting, all the mayors coming and going, everybody's promising, nothing is happening. So I think facility is one of the issue. There are huge talented young people who wanted to come and join the sports club, not necessarily only cricket. There are hockey clubs are there now. There are lots of Bangladeshi boys. There is Tower Hamlets hockey club. They're joining and they're doing well. So I think the facility is one of the area, and supporting those clubs and charities, those who are working in the sports sector, either from the local government, local council, and from different trusts. If those things can be done, I think there are potential. But the answer is the lack of facilities, I should say. Other than that, interest is there.
Thanks very much. We do need to wrap up, but I'll just, Your Excellency, did you want to say something? Your hand's up. Are you okay? That's perfect. Okay, so I think the great thing is we've got the DPH of London Borough of Tower Hamlets. So hopefully Shuman will be part of the steering group, and you're part of the steering group, and we'll work together collaboratively on that and see what we can do in terms of unique partnership working. And now let's, but I do want to say that it's a very valid point, and thank you for bringing your response, Ratan. What we're going to do now is that the questions that have been loaded up in the question and the Q&A panel, we will note it, and it's going to be added in, and we will respond accordingly. There will be recording and write-up available in due course. Now, just apologies, we're going over time a little bit, but I just think it's really important to kind of summarize this momentous meeting today and have final thoughts from my co-chair, Dr. Sharmin Shah Jahan. Thank you, Sharmin.
Thanks, Riyad. First of all, I'd like to thank everyone for attending this event. Without your attendance, this event would not be successful. So thank you to our keynote speaker, Her Excellency, and all our speakers and all our supporters and partners who attended it. আপনাদের সবাইকে অসংখ্য ধন্যবাদ আজকে এই অনুষ্ঠানে অংশগ্রহণ করার জন্য. And what I'd like to sum up is that there are lots of interesting questions. We would address those issues, but there is a real underlying, stress has been mentioned, but it's not just physical health. We need to take a really kind of look at health in a wider determinants of health, which includes housing, employment, access to opportunities, and sports has been mentioned. So we need to take a public health or life course approach for our future generation, but also preventive approach for today's, second, third generation of Bangladeshis who are here. Migration history of Bangladeshis and settling in a new country, that has got its own stress. We want to work together with you, with the NHS, with our other partners. And I welcome that, this launch is just the beginning of our journey. So please stay with us, support us. And all the speakers have shown the support and commitment towards us by being here today. And all of you who joined us, your ongoing support would be needed to disseminate our messages, our campaigns, our project work at the grassroots level. And Dr. Shuman Banerjee, I really would like to thank you, because you're in a borough where nearly 35% of the total population of Bangladeshi origin. We hold a lot of cloud experience and skills in the borough. And, together with this partnership, I think we would reach our objectives. So thank you, everyone, for your attendance. I'd like to close this because we've gone over slightly. Apologies for that. I'd like to thank Riyadh for, bringing all of us together. And I cannot thank my colleague, Sarah Atrada, enough, who is behind this Zoom admin. So thanks to Voice for Change England. Thank you, everyone.
Thank you.
Thank you. Thank you, everyone.
Thanks.
Thank you, everyone. See you again.
This is just the beginning. Thank you, everybody.
Bye-bye.
Thank you, everyone.
Thank you.